So next, we'll say about the MEN syndrome because there are certain MCQs related to this. So MEN syndrome, it is a autosomal dominant condition. We have MEN1 syndrome, MEN2 syndrome and MEN4 syndrome. Okay. So in MEN2 syndrome, we again have MEN2A and MEN2B. Okay. In MEN1 syndrome, it is also called as Werner syndrome. So note the M over here. So it is Werner. So Werner, don't confuse it with Werner, which is N. Werner syndrome is actually progeria syndrome, which is early onset of aging. So progeria is different. That is Werner and Werner, M for M. So MEN is also M, Werner is also M. So Werner syndrome is seen in MEN1. That is another name for MEN1 syndrome. And here the gene which is mutated will be MEN1 gene present on chromosome 11. So where all did we see this chromosome 11? Quite a few, right? So WT1 gene was there, WT2 gene was there, which was 11p13 and 11p15 respectively. Other than that, we had ATM gene also, which was seen in ataxia telangiectasia. That was also from chromosome 11. Here again, we have MEN1 gene, which is also seen in the chromosome 11 only. They are asking this chromosome number, so you'll have to make a tabular column and learn all these chromosome numbers separately. So in MEN1 syndrome, classically 3 P's are involved. So it is parathyroid, pancreas and pituitary tumors. So all of this will be neuroendocrine tumors. So parathyroid, it is going to cause an adenoma more than a hyperplasia. So it can either cause a hyperplasia or an adenoma, but more often adenoma than a hyperplasia. In pancreatic tumors, most commonly it is going to be a insulinoma. While in a pituitary tumor, it is going to be most commonly a prolactinoma. Okay, all 3 P's are seen in MEN1. While MEN2A syndrome, it is also called as Sippel syndrome, and here the mutation of the gene will be of RET. So similar to the medullary carcinoma of thyroid. So RET gene mutation was there, no? So RET gene mutation is also seen in MEN2A syndrome. So here the first part of the MEN1 syndrome is alone retained. So there is going to be parathyroid adenoma again. So the first P is retained, but the next 2 things are replaced. So there is going to come another P, which is pheochromocytoma arising from the adrenal medulla. And then we have medullary carcinoma of the thyroid. So this is going to be from the medulla of the adrenal. And here we have a medulla. So both medullas are there in MEN2A syndrome along with parathyroid adenoma. However, in MEN2B syndrome, again if it is a RET gene mutation only, but here you take the last 2 of the MEN2A. So the parathyroid adenoma is gone now, but both the medullaries are retained. So pheochromocytoma arising from the adrenal medulla is there. Then medullary carcinoma of thyroid is there. Then we have mucosal neuromas. And then marphonoid habitus. So all M's will be here. Okay, remember all M's are seen in MEN2B, while along with 1 parathyroid adenoma, there is going to be 2 medullas in MEN2A syndrome. Okay, then MEN4 syndrome, it is also going to be present like a MEN1 syndrome only, like it will present with parathyroid adenoma and pituitary tumors, but here the mutation is different. That is why they had categorized it separately. So MEN4 syndrome, the mutation is CDKN1B, and this also has been asked as an MCQ. So this table is very important.